As the world prepares for what experts predict to be a worldwide case surge as we move into the winter months, we wanted to know what to expect and how the knowledge we've gained over the past 9 months could help us weather this winter. I spoke with Dr. Amish Adalja, a senior scholar at Johns Hopkins University Center for Health Security, on what the next few months of this pandemic might look like. We are joined now by Dr. Amish Adalja, senior scholar at Johns Hopkins. Doctor, let's start with the numbers. Cases are going up. Is that what we should be focused on, the number of cases, or is there a better metric, in your opinion, hospitalizations or deaths?
Cases are important to keep track of, but what I really look at is the percent positivity of tests, meaning is it becoming easier to find cases? Is the outbreak accelerating in a given geographic area? Then I also look at hospital capacity. That's the number one thing that we're going to have to track as we go through this pandemic. Are hospitals getting inundated with patients? Do they have enough ICU beds? Do they have enough personal protective equipment? Do they have enough staffing? Those are the things that I look at.
Are you worried about a shortage in hospital beds as we approach flu season?
In some states, we're already seeing shortages. For example, in the Dakotas, in Utah, in parts of Texas and Wisconsin, we're hearing about hospitals really at record numbers of admissions and really worried about the ability to carry on their ordinary operations. And that's something that we can't allow to happen. So we have to get aggressive in those areas. I do think as flu season begins in earnest, and I've already seen flu patients, this is something that we have to think about, because flu will compete for the same ICU beds, the same hospital beds, the same ER beds, the same personal protective equipment as COVID-19. So we really have to prepare for a real intensification as it gets colder.
We have a lot of factors we're dealing with here, Doctor. What, in your opinion, is causing the spike and what isn't?
It's multifactorial. This is a pandemic that has been going on for 10 months or so now, so people are starting to get pandemic fatigue and letting their guard down. We're seeing that, for example, people are doing more things indoors now because it's gotten colder, and we know that the virus spreads more efficiently indoors. We've seen people get back to some semblance of their normal life, going to sports events, going to school events, going to school itself, or going to offices. All of that is causing people to socially interact with each other, and we know that the virus thrives on social interaction. So this is something that we had to expect as it got colder and as people started to get tired of social distancing. The key question is, do we have the public health infrastructure to keep those cases from occurring at a pace that's too much for the hospital system and the health department contact tracing teams to keep up with?
Do you anticipate more severe restrictions and possibly even another shutdown?
I don't think that there will be another shutdown. Nobody has shutdowns as their list of public health choice actions to take. What we want to do is targeted public health. Look at the case contact data, see which activities are spreading infections, which ones are not, and then give people protective action guidance to make those activities a little bit safer. So you may see capacity restrictions, or you may see, for example, people really being aggressive at certain events that might be occurring, mass gatherings, for example. But I don't think that we're going to go back to the shutdowns. I think people realize all of the ancillary damage that those shutdowns cause, especially when you talk about hospitals having to pause other procedures that they might have needed to take on patients. We saw other conditions, people with those conditions deteriorate. So I do think it's probably going to be targeted public health as we move forward, at least in the United States.
Right. Well, speaking of which, we're seeing significant surges in Europe. Do you expect that to happen here?
I do think we are going to continue to see acceleration of cases as it gets colder, as people can't do things outdoors, and as the virus also spreads more efficiently, not only indoors, but with the environmental conditions that occur during winter in this part of the world. So I do think we will start to see spikes, hopefully not as severe as what's going on in Europe, but I do think that that's something that is in the realm of possibility, because the virus hasn't gone anywhere, and we still don't have some of the basic public health tools that are needed, the test, trace, and isolate. That whole portfolio of actions are still not able to be executed by many states in the country.
What is the most important thing we should keep in mind right now that we've learned since March as we head into the fall?
The most important thing to remember is that you can spread this virus even if you don't have any symptoms, or you think you just have mild symptoms that aren't related to COVID-19. That's what's driving that. It's people with mild illness or no symptoms at all that are going about their activities of daily life, and their guard is down. Maybe they're not wearing a face covering. Maybe they're attending a lot of events with people. They're not practicing social distancing. That's what's driving it. This is a virus that transmits efficiently from person to person. It's established itself in the human population. We're going to be contending with this even after a vaccine, because there are going to be people who don't get vaccinated vaccinated. There are going to be new people that are born every year that are susceptible to this virus. We know that other coronaviruses have been something that we deal with on a seasonal basis. So I do think what will happen is we'll get new tools, we'll get a vaccine. This will become less of a public health problem, but it's never going to be a virus that disappears from the face of the earth or disappears from the human population. So we have to understand how to take common sense precautions to be able to protect ourselves from this virus.
Dr. Amish Adalja, we always appreciate your time. Senior scholar at Johns Hopkins. Thank you, sir.
Thank you.